Let's talk about something that's incredibly common but can also be really confusing: abnormal uterine bleeding. It shows up differently at different times in life, from the very first period all the way to the years leading up to menopause. Today, we're going to demystify the whole thing.
Okay, here's how we're going to break it all down. First, we'll figure out what abnormal even means. Then, we'll look at how it can show up in teenagers versus during perimenopause. After that, we'll dive into the tools doctors use to find the cause, and finally, we'll wrap up with how it's all managed.
So, first things first. Before we can get into the weeds, we have to ask a pretty basic question. What are we even talking about when we say bleeding is abnormal? Because, it's not always what you might think.
And this definition is absolutely key. It's not about measuring a specific amount of blood. It's all about the impact. If bleeding is getting in the way of your life, if it's making you miss work or school, if it's causing you stress, if it's making you anemic, that's when it's considered heavy. It's about your quality of life.
So, to figure out why it's happening, doctors have this really clever system called Palm-Cohen. It neatly sorts all the possible causes into two big buckets. The Palm side is for structural causes, things you can actually see, like polyps or fibroids. And the Cohen side is for everything else, non-structural stuff like bleeding disorders or hormone issues. It's a fantastic roadmap for getting to the right diagnosis.
All right, let's jump to our first major life stage, the teenage years. This is a time when the body's entire hormonal system, what doctors call the HPO axis, is basically like an orchestra just learning to play together. It takes a little while to get in sync.
And because of that, for a lot of teens, some irregular bleeding is totally normal. It's just the brain and the ovaries figuring out how to talk to each other. But, and this is a big but, while some irregularity is expected, really heavy bleeding from day one can be a major red flag. And this number is a real eye-opener. Think about that for a second. 1 in every 5 teenagers who goes to the doctor for heavy periods actually has an underlying bleeding disorder. So this isn't just teen hormones. It could be a sign of a much bigger medical issue that needs to be addressed.
And that is exactly why major medical organizations, like the American College of Obstetricians and Gynecologists, have put out specific guidelines. They want to make sure that teens with this issue get the right workup right from the very start.
This quote from them really gets to the heart of it. That first super heavy period isn't something to just brush off. They call it a sentinel event. Basically, they're saying, hey, pay attention. This is a critical clue that something else might be going on.
So when you look at how they recommend approaching this, it's really all about being patient-centered and gentle. The focus is on using medication to control the bleeding, not jumping to surgery. It prioritizes comfort, often avoiding invasive exams, and really emphasizes checking for anemia and teaming up with blood specialists if needed.
Okay, let's shift gears completely. Now we're jumping from the very beginning of reproductive life all the way to the transition toward the end, perimenopause. This is a time when, let's be honest, the hormonal rulebook kind of gets thrown out the window, and that creates a whole new world of bleeding patterns.
You can see how this all unfolds. It often starts with cycles actually getting shorter and closer together. Then, things can get a little wild as ovulation becomes a bit of a guessing game. You might see spotting or skip periods altogether. And in that last stage, when ovulation is rare, the uterine lining can get really thick, which can lead to that super heavy, unpredictable bleeding.
So even though a lot of these changes are just hormones doing their thing, there is one thing that is always the absolute top priority for any new abnormal bleeding in this age group: making sure it's not a sign of something more serious, like a precancer or cancer of the uterine lining.
And this chart? Wow. It shows you exactly why that vigilance is so critical. Just look at that jump in risk as women move from their 30s into their 40s. It goes up more than 15 times. It's not a small increase. It's massive. And it's why doctors take this so seriously.
Okay, so we've seen the what and the when. Now, how do doctors actually get to the bottom of it all? Let's take a look at the tools they have in their diagnostic toolkit.
It's not just guesswork. It's a really logical process that starts simple and gets more specific as needed. It always begins with a good conversation and a physical exam. Then come the basic lab tests. You got to rule out pregnancy, and you need to see if the bleeding has caused anemia. After that, you can move on to imaging or even sampling if you still need answers.
The first and most common imaging tool is a transvaginal ultrasound. It's a quick, non-invasive way to get a first look inside. It lets doctors measure the thickness of the uterine lining and look for any of those structural palm causes we talked about, like fibroids.
Now, if they need a super clear picture, they can do this really clever thing called a saline infusion sonogram. Basically, they use a little bit of salt water to gently open up the uterine cavity during the ultrasound. It's kind of like inflating a balloon just a tiny bit to see the patterns on the inside much more clearly. It's great for spotting small polyps.
But, to be absolutely sure, sometimes you need to get a tiny piece of the puzzle itself. That can be done right in the office with a thin little tube. Or, for the most direct view, a procedure called a hysteroscopy uses a tiny camera to look right inside the uterus, which lets the doctor see exactly what's going on, and even take care of things like polyps at the same time.
Okay, so we've done all the detective work. Now for the most important part. What do we actually do about it? Let's look at how all of this leads to a treatment plan that's right for you.
The game plan is almost always to start with medication. That's the first line of defense. Things like hormonal birth control or a hormonal IUD are fantastic at controlling bleeding, and there are great non-hormonal options too. Surgery? That's usually kept in the back pocket for when other things haven't worked or for very specific problems that need a physical fix.
And I love this slide because it shows that the goal isn't just to stop the bleeding. It's so much bigger than that. It's about getting things under control quickly, fixing any related issues like anemia, treating the root cause, and ultimately restoring a sense of predictability and improving your overall quality of life. So, here's the bottom line. While abnormal uterine bleeding can feel confusing and overwhelming, there's a clear, logical path to figuring it out and treating it. And the really good news is that whether you're a teenager or you're in perimenopause, there are great, effective solutions available.
It is so easy to dismiss heavy or irregular bleeding, to just think, well, I guess this is just something I have to put up with. But it isn't normal. It's often your body's way of telling you that something's a little bit off balance. The most important step is just to listen and to start a conversation. Hopefully, this explainer has given you a good place to start.